Hi everyone. I just wanted to check if I'm audible. Wonderful. So I hope my screen's visible to everyone.
Yes, it is.
Great.
Yes.
Wonderful. So I think this, since we have very short sessions, I'll make the intro very brief. So thank you for organizing the event and inviting me to be a part of it. I think this is a wonderful initiative. I've learned a lot from my previous speakers. So today I will touch upon a very particular aspect of how robotic surgery is evolving at present and what is the role in bringing in augmented reality and virtual reality into it and how AI is going to play a role in that aspect. So to do that, I'll just set a very quick foundation for everyone. I'm sure most of us are already familiar with this, but just to clear things up, so there's often a lot of confusion between what comes under AR, what comes under VR, what's mixed reality. So virtual reality is when you create a completely digital environment where you have no interaction whatsoever with your existing or current environment. Augmented reality is when you're fully aware of your surroundings and there is some amount of digital overlay on your existing actual surrounding. Your mixed reality is when you're able to combine both, right? So augmented reality uh, falls under that bracket. Virtual reality is actually when you can, mixed reality is when you can bring in physical objects into your virtual world. So this all these three technologies together constitute the entirety of the spectrum, which we refer to as extended reality. And moving forward, barring very few scenarios where training is very particularly required, we are all going to see it become a singular form of extended reality headsets. And that is where the hardware industry in this industry is taking us towards as well. So, hope this gives everyone a quick glimpse into how we are going to approach extended reality in this talk and in the future. Moving on to how currently surgical robots are being deployed. Traditionally, there have been three types of surgical robots. The most commonly used ones are the master slave systems, where you have a separate console for the surgeon, and the robo mimics or performs whatever actions which the surgeon wants it to do. Think of it in terms of a remote control toy, in where you press certain buttons, you perform certain actions, the instruments will do exactly what you want it to do. That is where we started. That was the first set of surgical robots which came on board. I think all of you will be familiar with the Da Vinci, which is very similar to the picture on the side as well. Zeus was observed by Da Vinci, and they have been the primary source of surgical robotics for the past 2 decades. But now, over the last 7, 8 years, we do have a lot of other companies coming on board as well. The active and semi-active ones are what is being actually enabled by artificial intelligence. So when you're looking at semi-active, here the systems are able to perform certain very minute aspects by themselves. The surgeon can take the, for example, nailing a screw. The surgeon can set the depth and then ask the robotic arm in particular to perform that particular action and then take over the process right after that action is done. What we are moving as the next stage towards is the active robots. This is more commonly seen in orthopedics and in areas where robots are dealing predominantly with harder materials, bones, cartilages, arthroscopy, and so forth. So here you can actually take this is a slightly outdated list, I would say, probably about by a year or two. You do have certain newer additions, but by and large, you can see that whatever is listed under general surgery are master slave robots. These are the ones which provide you access to the abdomen and deal predominantly with the soft tissues. Then you have your orthopedic and spinal surgery robots. These ones are closer to semi-active and active, and they will probably be the first to make a transition into entirely being active robotic surgeries. And then you have certain other robotic equipment coming in where smaller procedures, lung biopsies, skin tumor excisions are all being taken care of. So now when you move on to where in surgery we are actually seeing AR and VR playing a role, I think by and large you would have, the entire fraternity has probably seen the articles where we've started using Apple Vision Pros in ORs to help assist with the surgery. Of course, it's not yet, I would say, feasible for us to adopt it on a day-to-day basis, but the preliminary foundations have been laid for that. So here, what you see in your picture is where once a surgeon wears a headset, he can see overlays of any other patient data displayed at a very convenient angle. At this point, unless there's going to be real-time assistance and requirements, usage in certain other surgeries seems more gimmicky to the detriment of how we use technology. In virtual reality, the utilization is very clear. Uh, you predominantly use virtual reality only with training scenarios. The challenge lies in recreating those training scenarios with a certain degree of accuracy when it comes to virtual reality. And where are we moving the next round of application is being able to use it for preoperative planning, uh, preoperative approach, intraoperative guidance, and finally remote surgical assistance. So I wanted to showcase a couple of case studies. So the first one involves AI enhancement and in augmented reality for tumor resection. This was actually a study which has been published from the Hunan Engineering Research Center of Skin Health and Disease Laboratory. So they identified three very key functions. They wanted to have AI assistance in tumor boundary segmentation, in designing the surgical margins, and navigation in intraoperative tissue sampling. The results, though the sample size was roughly around 100 cases, the results were very, very promising. So you're getting AR navigation mapping error was under a millimeter, which is phenomenal, especially when you're comparing it to human performed surgeries. And there is a very high accuracy in boundary segmentation, both in malignant and benign tumors. So the accuracy in both cases was roughly at around 95 to 96% accuracy, which previously was determined at around 75 to 80%. So they've given a quick workflow of how they've actually gone about the process. So they capture images. I think that falls under your data gathering phase of the process. Benign, malignant. Your AI algorithm then does the preoperative planning and demarks how it is supposed to, what is the tumor margins that you need to excise. And then there is a projection onto the skin. So the flip side here is without a headset, they've been able to project the boundaries required onto the skin, and then you have a robotic arm excising what has been projected. So these are all three individual components which they have been able to bring in from various aspects and marry together to form a surgical system. The accuracy will definitely keep improving once all of this is combined into a single system where it all flows seamlessly instead of having to depend on separate data sets coming into each part of the process. So here you can see that once in benign, it is after it is excised, you're done with the process. Whereas in malignant tumors, you're able to take it to uh, recapture the image, do a pathology, rapid pathology matching, and then do a repeat sampling until there is no residual tumor left. So this process is something which I feel is path breaking, and this is again something which a fair few other institutions are also en route achieving, and this provides a very realistic and achievable way of integrating augmented reality into our surgical pipeline, and where AI can actually enhance that. This is another key project which we at Medicine are actually a part of. This is how we are going to be integrating virtual reality to surgical training. And of course, the future will be how it can actually move towards real-time surgical assistance. The first aspect with any as per any requirement when it comes to AI is the collection of data. And here we are looking at CT and MRI data at particular consistency. This is then recreated into a patient. So here we have seen, I think over the last 10 decade or so, recreation, CT-based reconstruction has become the norm. And at here, AI has been empowering this for quite some time now. And but to adequately do it with soft tissues and with higher accuracy is where I think AI can help accelerate the process. And once you have the more accurate your recreation of the virtual patient, the more accurate your approach and planning can be. So once you have your digital twin or the virtual patient from there, we have you can start practicing your surgical approach and planning. uh, this is a very key step because in real time, tracking errors of the surgeon in various approaches and the data gathering is something which is very challenging unless it is being performed by surgical robots. And this is the catch 22, which is actually slowing us down in terms of being able to collect required data from the machines and at the same time funnel that back into into the cycle to make sure that we can keep improving our accuracy. So that is where virtual reality can play a big role because now with your in a virtual environment, you can track every single action. You can track the movement of the instruments. You can make mistakes. You can try different approaches and see what is the damage you are causing to various other tissues and organs. This data gathering is currently what the VR aspect is empowering. Once you have that data, then again we are working with a company based out of UK, where their long-term goal is once they are able to identify a best approach, this will then provide the platform for them to start providing real-time analytics during actual surgery, real-time guidance, because we do not at present have adequate data to provide real-time navigational guidance to the surgeons, be it for endoscopic procedures, endoarterial procedures, or even laparoscopy and so forth. So this is, I think, what we see as the future direction for integration of AR VR into robotic surgeries. There's a very clear emerging trend. One, we are moving away from very segmented AR or VR systems, and all of that is being integrated under the mixed reality umbrella or the XR umbrella. The all the hardware manufacturers have moved to a way where you no longer call them virtual reality headsets. Their inside out tracking is so good that you can use pretty much most of the headsets for mixed reality. Integration of 5G for real-time remote surgery. This is again something which has now been performed multiple times. It was always a question of when it was going to be feasible for them to make it available to, I think, the general public, or I would say the general healthcare fraternity, for us to start doing promoting more research along these timelines. Then and finally, you're looking at advanced AI algorithms for decision support. So this again is something where decision support is something which we can track based on all our data collection that has been done and us being able to very accurately recreate patient engines with AI support in that area. So this is now going to translate to it achieving a particular amount of accuracy and being utilized in the real world. Then when you're looking at our areas of research, which is now the focus area for the next few, I would say, years till we move on to the next phase of actual implementation, would be your standardization of data collection in the virtual reality environments. This is something I would say is actually solved by having all data collection happen in virtual reality environments rather than trying to map that to real-time data collection, which creates that I would say a dichotomy in terms of data collection. The first area is the recreating real-time surgical environments. This is again something where we are still technologically challenged. Once we are able to do this, you will be able to recreate uh, scenarios where surgeons can perform surgeries or get a feel of the actual environment when they are performing surgeries from a remote area. So this again allows not just robotics, but real-time surgical application of AI in various areas and aspects as well. So what are the challenges that we face when accelerating these technologies and these devices being adopted? One, reporting of surgical errors. Surgical errors are often fixed on the go by the surgeon. And on in real-time data collection, that is something which is even as a surgeon myself, I can attest to the fact that certain smaller navigational errors and attempts and thing is accepted as part of a process during difficult surgeries. That may not even be accounted as an error. But if we repeat this, if we are able to recreate the same aspect in a VR environment, we will be able to identify which are errors and then maybe solve that challenge. And the second area is the catch 22, which I mentioned earlier, is that we'll not be able to recreate this process and keep testing it in a real time area because the stakes are so high, which means, again, where do you test it? And without testing and data collection, it is again going to hinder the development process. So I think with these insights, I would probably like to finish up. I'm close to, I think, on my time limit as well. Thank you so much. I think to anyone who wants to get in touch, my details are right there. I'll be happy to talk about this and more.
Thank you. Session. This is one question from the audience to Dr. Siddiq. Sir, how effective can AI be in identifying the warning signs of sepsis?
Sunil, I'm sorry, I missed your question. Could you repeat that again, please?
Yes, sure. The question is, how effective can AI be in identifying the warning signs of sepsis?
See, if you think about the traditional working is temperature, heart rate, blood pressure, drop in urine output. I mean, these variables are the white cell count, the laboratory parameters. The way we kind of currently manage is once they're going up, we kind of put them together and then make a considered judgment. Now, that over a period of time, we learn that as part of our medical training. So, if a senior critical care physician, it's not a big of a challenge, but on shift maybe a resident doctor who has to put all this heterogeneous data together to figure out what is going wrong. As my subsequent speaker mentioned, in ICU, the information overload is so much per patient. For them to for a non-experienced doctor to make the right judgments, it becomes challenging. And of course, you want to empower your nurses, your advanced nurse practitioners, your medical residents in training to provide the same level of training, care as your consultant physicians can do. So I think so. If you think about AI in healthcare and medicine, it's a great bridging the gap, and of course help even physicians who are experts who are dealing with bunch of patients to say who's at risk of developing this. In the end, the physician will be the one who will be making the decisions, like just like a pilot, a pilot in the who's flying a plane. There's a lot of data, a lot of automation, but in the end, the pilot will make the decision using all the informations we give them. I don't know if I've answered that question very well, but that's how I see. I think so. My subsequent speaker from UK put that in nicely in ICU settings, because ICU, there's a huge amount of information overload for per patient, and these tools will help them make better decisions.
Definitely, definitely. So thank you for the answer. One quick last question we will take here. It's for Dr. Adith. So what are the most common types of surgeries that are currently benefiting from the AI-powered AR and VR systems? I think you are on mute, sir.
Sorry. I think directly benefited from AR and VR is actually quite minimal, because virtual reality is again a training system, and augmented reality being used in surgery is still a very novel concept where we have only started utilizing it for the last few months. But in terms of actual AI powered robotics, yeah, clearly there is utilization in orthopedics. A lot of the orthopedic surgical robots have semi active components and are working on active components as well, which means that segment is very heavily powered and influenced by AI.
Okay. Thank you. Thank you. There's one last question, sorry, for Dr. Casper. In what ways can AI improve the orthodontics, for example, in designing the braces and dental implants?
Okay, can you hear me?
Yes, sir.
Yeah, for now, our company, we don't develop the AI design for brace design or dental implant design yet. Sorry, it's a quite different, totally different
Okay,
category.
okay.
Yes.
So we have something to look forward to then.
Yeah.
Yes, yes. Okay, thank you so much. Thank you, all the panelists. Over to you, Dr. Amit sir, to carry on the panel discussion.
So once again, thank you very much to this multidisciplinary speaker session.